A constant challenge, a persistent challenge with social interaction, with communication, repetitive behaviors, and restricted interest. Neurodevelopment disorder, ASD, Autism Spectrum Disorder. This is on the rise. One child in every 36 today has autism. This autism spectrum disorder affects the child's perception about the world, its interaction with people, and its surrounding. We have with us today Aditya Mudgalkar. He is a dedicated child psychologist and has invested quite a few years in addressing autism. He's worked with children that have autism. He also specializes in ADHD, play therapy, and a lot of other therapies to do with child counseling. He's the co-founder of Mano Care, Child and Adult Counseling Center. He has this great passion of making counseling accessible to a lot of people and wants a lot of inclusivity in society. So Aditya, thank you so much for coming on MimamshaTalk.
Thank you. Thank you for having me.
Well, I want to know more about autism. I want for the audience to know more about autism and some of its misconception, if you could tell us some more.
So like you said, autism is a neurodevelopmental disorder that affects 1 in 36 children. And one fact about it is on rising. With the new technology, the way the world is going, the direction, it is on the rise.
Okay.
So let's go back to what autism is. Autism is basically a social deficit in children. That happens because of a lot of issues. There's no one factor. So one is genetical. Another factor is that, there's a lot of processed food that's been eaten by people.
Okay.
Third factor is that there's a mutation, maybe genetical disorder, or there's radiations, mothers. So those are some of the factors. Or maybe when during the pregnancy, the pregnancy was not done properly.
Okay.
Okay. So those are some factors that affect autism. So autism in reality is a social deficit. These people do not understand the cues, social cues that a lot of people have.
Okay.
They may come off as rude to other people. They may come out as insensitive to other people.
All right.
But it is important for us as a therapist and other people to understand that it is a disorder that needs to be focused on, and there needs to be more awareness about it as well.
All right. Now that you talk of awareness, these are some of the symptoms that you see in autism, where we said, repetitive behavior, where communication becomes very difficult. Even, certain mannerisms also affect them. So could you elaborate a little more on these kinds of symptoms that, parents can become aware of?
So one of the things that parents need to look out for, the early symptoms, is that if you're playing peekaboo or if you're waving at the child, the usually child gives a smile or some kind of response. But when a child who has symptoms of autism will not respond to it in that way,
Okay.
that is the early signs of autism. It can be determined at the age of around 6 months.
Okay.
So around 6 months, if your child is not responding to you, some people take it in the wrong way of maybe the child has a hearing disability, but it could be some signs of autism as well.
Okay. So are there any more signs besides, their response towards your behavior?
Some of the signs, once a child is around 9 months old, they tend to play alone. They tend to prefer playing alone instead of playing with other people.
All right.
And they would rather, if you try to interact with them or play with them, they would prefer playing alone.
All right. Even with the parents, if
Even
the
with
parents want to
parents.
play with them.
Yes.
Okay.
So those are the things that you look out for. You'll see when playing with a lot of their toys, they will have one particular toy they would be playing with. Another way is they will have something, they will take wheels or circular objects and they will spin it around a lot. So those are some signs that the child has symptoms of autism. Now, what can parents do at that stage is, if they feel like your child has symptoms of autism, the first thing is to maybe have a consultation with a pediatrician pediatricians,
Uh-huh.
where they can have a conversation with them, have a conversation with child psychologist, maybe occupational therapist,
All right.
and even a general physician,
Okay.
for instance. So those people can maybe tell you that this is something that we need to look into. Sometimes a pediatrician might say, let's wait for 3 or 4 months and see if the symptoms are there, or if they are residing, or they're growing. And then that's when they take a call whether we want to go for therapy or not. And one of the key factors with any mental disorder or neurodevelopmental disorder is early intervention is key for them.
Okay, I do understand this early intervention. However, my question here is, at least what I've seen around us, is that a lot of parents in India put this down to this kind of behavior, repetitive behavior, or speaking a little later in life. They just put it down to childish behavior, that the child is growing, because some children, they do blossom a little later in life. They
Yes.
speak a little later in life. So how do you correct this? I mean, they can come to a pediatrician or a child psychologist once they become aware,
Yes.
which we're trying to do this right now. It's talking about it.
Yes.
But what about parents who are not aware and just, put it down to the child still has to grow up? So how do you correct this? Is there any way?
So one of the things we have started doing is to create awareness about autism, having a lot of conversation about autism. That a lot of parents who have come in for therapy at a later stage, where they realize that this is a big problem, they started to feel guilty about it. That they basically maybe knew a little bit about it, but they felt like, oh, my child can't have it because there's no history of autism in our family. So it is important that we create this kind of awareness where we are talking with the parents, we're giving them trainings, or we're giving them conversations, having conversations with them about those things.
Okay.
That will help them not to kind of put it under the carpet.
Okay.
But still, even after, what I've noticed is even after they have those kind of awareness programs, they still are in this assumptions that, maybe my child will not be able to have those things, or maybe my child will not have it, because they don't want to believe that their child has some kind of problem. That is the beginning point for us as well as a psychotherapist, as a child psychologist, is to understand, make parents understand that, their child has some kind of disability. And they take it from a negative way because they have societal pressure, because they don't want to show their child in a negative light.
Yes.
But
Sorry.
but the parents who accept it at an early age, they have seen a significant change in how their child progresses when it comes to autism or
Okay.
any other neurodevelopmental disorder.
Okay. All right. So as early as 6 months of age, you're saying, is when you can detect this.
Yes,
All right. And early intervention is the best.
the best.
All right. So if they have delayed the intervention, or understood it maybe when the child is, say, 4 or 5 or 6 years old, would that hamper or dampen the progress?
Yes. Why? Because when your brain is in a growing stage, when the therapy comes in, it kind of helps the child, to grow in a certain perspective. So when you give them practice of maybe social cues or social skills, um, it helps them to grow in that manner. So a lot of the things that we do in therapy is to focus on social skills, focus on, promoting them, pushing them to have a little bit of social conversations, teaching them basic manners because they don't understand them, and then
Okay.
talking about what issues they face. So there's a
Right.
bit of rigidity that it goes with autism as well.
Okay.
Their resistance to change. And some of the things that has helped parent as well, we have a conversation with parents. We tell them that, they're going to follow a very strict routine, and they do not like sudden changes. So when, for example, if a child is going for a wedding, we always tell the parents to have a conversation with the child about what is coming their way. So they are mentally prepared for those kind of events.
Okay.
Or maybe in school, if there's some kind of changes that is going to happen. So those things are very important to kind of tell them that this is coming your way. So be prepared for it as well.
So what you're saying is that they are not open to change.
They're not open to change, yes, to some extent.
Okay, all right. And so is this a kind of a therapy that the parent has to first go through? The parent has to be educated first.
Yes.
Is that it?
Yes. So because the child is coming to us for therapy for maybe 2 or 3 hours a week, but the rest of the time the child is either at school or at home. So it is best that we tell the children, maybe to give them tips about certain things that they can do at home with the child,
All right.
how they can parent the child, because each child with autism is different.
Uh-huh.
The fact that it said spectrum means that not one child is the same. How one child is going to react to you, or how there are different children I have who come to us for therapy. Every single child is different, and every child doesn't have one kind of therapy that works on them. So it's a combination of different therapies that we do on them, and then we kind of have a little bit of trial and error there.
Okay.
And then whatever therapy works, we continue with the therapy.
All right. Good, you said trial and error. So we're focusing so much on parents. What if that child has siblings?
So when it comes to autism, what I've seen and what research I have read, there's 10% chances that the younger brother or older brother might have autism.
Oh, okay.
Yes. And what happens with this kind of children is that the parents, especially in schools, the younger sister, older sister, or maybe brother has to take care of the child if the child is on spectrum, on a severity. If the younger brother is on a severe spectrum, the older sibling or the younger sibling tends to take care of in school.
Okay.
The dilemma that comes up in this situation is a lot of parents question that, maybe that child has a different life of their own, and they don't want their older children who is maybe a mild or with no autism revolve their life around their younger, older brother. So usually parents try to put children in different schools.
Okay.
So they are two different ways. But then parents have to make sure that their child who is diagnosed with autism has some kind of shadow teacher who's helping with education.
Okay. All right. So what is this shadow teacher all about?
The shadow teacher, if the child is either mild to severe, moderate to severe autism, usually there's a shadow teacher who sits besides the child and helps them with the education, and if the child has any sensory needs at that moment. So usually a child who is old, who is basically having difficulty focusing in class, or maybe the noise around them has a sensory issue there where he's not able to manage, the shadow teacher might take the child outside of the class,
Okay.
take them out of that environment to let the child calm down. In therapy, we take the child to a sensory room
Okay.
where the senses are basically integrated and the child has his own time to kind of process the information.
Okay.
And one major factor that we have noticed in our practice is that every child has a different sensory need.
All right.
Some have needs, some get very anxious when there's a lot of noise, maybe noise, or there's some sensory overload. So it changes according to child. What is it? Some seek for more sensory needs, like they want noises, they want, they're sensitive to some lights, bright light.
Okay.
So it changes according to the child. So we have to be very careful with every child who's diagnosed with autism. And one of the things, the recent research that I read about autism is that, for example, I'm talking to you right now, and you are able to filter out the noise that is important to you, prioritize the voice.
Yes.
But when it comes to autism, they tend to hear a lot of different noises in the same frequency. So, for example, if I'm talking to a child who's with autism, diagnosed with autism, he is able to hear my voice. He's also able to hear the fan that is going on in the room, or maybe someone else talking at the similar frequency. That creates a kind of a sensory overload for them.
Yes.
And then they are not able to process those informations, and then they don't know how to react. Therefore, the tantrums
The
come in.
tantrums. Oh my God.
So
Okay.
one of the things that I first, when I got into, studying autism, is that there's a lot of knowledge about autism, but I wanted to understand how autism feels.
Yes.
Because as a therapist, it is important to be in their shoes
Yes.
and understand what they are going through.
Yes.
And sometimes we look at it from our perspective and see that, oh, why is this child doing this? Why is he, throwing tantrum all of a sudden? But when you understand that, this is what is going on in his mind, then it becomes very easier for us to give them therapy as well.
Oh, wonderful, wonderful. I wish, most of the psychologists and psychiatrists come with a lot more compassion and empathy, because you really need that.
Yes.
In the course of your conversation, you spoke about anxiety,
Yes.
that they become anxious. So I read somewhere that, they come along with anxiety and depression also.
Yes.
It's not just these social deficits, but they also go through all of these kinds of angst. So how do you manage all of that? Because I'm sure that could be, again, a different technique that you would have to use, right?
Yeah.
Or it's the same.
So when it comes to if the child has a lot of social deficits, if they're on a moderate to severe kind of thing, we give them kind of a simple coaching where we tell them that you're in this situation, and we do a lot of role play in therapy. So in the role play, we kind of promote them, that, maybe you are a teacher, I am a student, or maybe I am a teacher and you are a student, you're in classroom. So we do different kind of roles, maybe like I gave you an example of wedding. So we do a lot of role plays. The role plays kind of help them understand how they should behave in a certain situations, and what is rude for other people and how people are perceiving you. So that kind of gives them a little bit of clarity, and this has to be done repetitively for like 3-4 sessions.
Yes.
Because it takes them time to process those information.
Yes, absolutely.
So the anxiety comes from the fact that, they tend to realize early on that, there's something wrong with them, or there's something, people are treating them differently. And then they question themselves, oh, am I good enough? And the self-esteem kind of gets affected. A lot of people feel like, just because they have a disability of some sort doesn't mean that they don't understand, what you are saying about them or what the world thinks about them. They're still processing the world, but in a different way. So the anxiety comes in there. And second part is the social anxiety part, where sometimes we tell them to kind of go have a conversation or live that moment. So when you practice with them, the role modeling with them, we tell them to go maybe in the classroom. Your job today is to have, answer one question that teacher has asked. Something that they fear, they have not been doing it, they're anxious about it.
Yeah.
And then that's when the social anxiety comes in, because they are not interested a lot of times to talk to other people because they're happy in their own world.
So this, sorry, continue, yes.
Yeah, so this kind of affects them. So when you push them, they get anxious, and they don't understand the need to communicate with someone sometimes. They feel like there's no need. Why should I say hi or bye? Why should I say good morning to someone? Or why do I need to answer the questions in the classroom? I'm happy the way I am. A lot of children with autism are in that think in that way. So the anxiety comes in for that factor internally, as well as social anxiety comes in because they have to speak somewhere. So they do not like it because it is out of their comfort zone.
Yeah.
So we treat them, sometimes they go to a psychiatrist if the anxiety is at a very severe level. They tend to give them medications. There's a lot of focus on nutrition as well.
Okay.
Diagnosed with autism. So those are the underlying cause that gets taken care of.
Okay.
And then depression comes in with a mindset that they feel like they are somewhere lesser than the other people. And they feel like, maybe I'm not be able to achieve what other people might be able to achieve. Maybe they get anxious, maybe they wanted to speak to someone, or they wanted to do something or achieve something, but they were not able to achieve those things. So they kind of inner beating of themselves up that, if I was not able to achieve this,
Okay.
kind of comes in. So that thought process kind of affects them. So one thing that has, so basically psychiatrists, therapists, psychotherapists, and all of them kind of help them get help with the underlying causes, anxiety and depression.
Okay. Wow. So you need to have actually a team of doctors. You need to have a pediatrician, a child psychologist, a child psychiatrist. Everybody together, I think you'll interact and then decide what is the kind of treatment you have to give the child.
Yes, and there's also a speech therapist if they have delayed speech. There's occupational therapists. Some children have issues performing daily lives, who are diagnosed with autism or are in the severe or more severe.
These are the levels of autism, right? I read that you have got 4 different levels.
Yes, 3 different levels.
3 different levels. Okay. So which are those, and what are those factors, or I do not know what you call them, determiners that tell you you're level 1 or level 2 or level 3?
So mild autism is basically they are independent. They're able to focus on a lot of their daily activities.
Okay.
And do it, most of it, independently.
All right.
But sometimes they struggle with, social interactions,
Okay.
understanding social cues. And it doesn't really affect them as much in the, academics or other aspects of life.
Okay.
When it comes to moderate, it starts to affecting, their academic life, their daily life a bit, and their social life as well.
Okay.
So they have some kind of deficit where they will not just speak with other people. They also have challenges in terms of their academics.
All right.
They're not able to process the information and all that. And severe is that they have basically comorbidity with other neurodevelopmental issues. So that means they can have intellectual disability, diagnosed with intellectual disability. They have ADHD, and as
Okay.
well as they have diagnosed with autism. So in simple language for everyone to understand, the first is basically while you're using Google Maps, for example, you ask someone for the road and they just direct you the road. So you're able to go independently there. Second is that you need a Google navigation, second level, to be able to go from point A to point B. And the severe is that you need someone sitting next to you to help you get there.
So different levels of support for different levels of
autism.
autism. Wow. Okay. My next question to you is, I wrote a lot about these Sundarji schools that, look after special needs children. We have one in Pune city. They do a fantastic job. It was at that time, talking about 8 years ago, so they talked of inclusivity.
Yes.
And the teachers were going to be trained on that. And they were going to train teachers from schools. What is this inclusivity and how does it work and help people with disabilities and especially autism?
So inclusivity is basically we're trying our best to get the child from a special school to a mainstream school, where usually if child is able to do their daily activities, daily tasks, academics properly, there's a lot of push from getting the children from special school to mainstream school.
Sorry.
And the thing with inclusivity is that these children, for them that to happen, there needs to be a lot of awareness with the teachers, with the principal, with overall school as well, that you're going to have a friend for children who's a little different than you.
Okay.
And there needs to be an acceptance for that. Well, now, because that thing, it has become difficult for everyone to kind of, create awareness in children as well from that younger age, they have started having a special department where their focus is on special children. So they have special educators there. They have teachers who are well aware about the disability that every child has, and they teach them in a different way, because it is not just about child being in a mainstream school. It is also about how they process the information.
So then the word inclusivity,
Yes.
you're putting them in a mainstream school. So where does the inclusivity come in? Because then you're again segregating them from the mainstream.
So a lot of the activity, so inclusivity comes in when, maybe they are able to hang out with other children who are not just in their classroom. They have some of the classes where they have classes together with the other children as well.
Okay.
So it is not just, you're in one set of classrooms and you're just interacting with the children in that classroom. They are able to hang out with friends who are from, mainstream school. And they are also a part of where they're having classes, some of the classes like physical education, some of the classes that they can manage at that point together.
Okay.
And for a child who has mild to low autism, there is a lot of push to get that child into a mainstream classrooms.
Okay.
And this is just the inclusivity comes in where, these children are put in that classroom. And the second part is if they are not able to cope with it, they come back to the special classroom that there is in the school.
Okay. All
So
right.
because of the interactions with different kind of children, there's also an understanding between the teachers, the children, and the other people that, we're going to have a friend in the whole vicinity of the school.
Yes.
Was a little different. Children are a little bit curious about who they are, what they are, why are they like this. But once they're told, some children become very good friends with children with special needs.
Lovely.
And I have had a lot of heard stories about in schools as well as from parents as well, that we pushed the child to go into mainstream schools, and they made fantastic friends with some of the kids. And the kids support them in terms of academics. So they, usually the children would especially with autism, would not want anybody next to them. They don't like social interaction.
Yes.
Because they have made friends with, children from mainstream schools.
Yeah.
Those children willingly come and interact, make that effort to be friends with them. So that kind of affects and impacts their lives as well. So they're more understanding as well.
That's so lovely.
Yes.
Really. And at what age then does this inclusivity take place? At what age can the child now be put into a mainstream school?
It really depends on the severity of autism that a child is diagnosed with. It depends on how well he or she is able to cope with the mainstream schools. Because I have seen parents, the other side of the story is I've seen parents who don't want to put the child in special schools because they still believe, or there's a hope that my child will be able to manage mainstream schools. But sometimes it backfires on the parents as well as the child.
Okay.
So it is basically a collective decision taken by the parents, the psychologist, a pediatrician, psychiatrist, and school together, that if they're able to cope with the syllabus.
So it's not just picking up the child and
putting
putting
it
it
in
in
the
the mainstream.
school.
Oh my God. Yeah. Okay.
And if the child is able to manage and do well academically, then that is fantastic for the child as well as school.
Okay.
There's also one more story that I've heard from a lot of parents coming, is that they do not, the schools do not take special child because it affects the image of the school.
Oh, okay.
So that is also a factor, that the school is not willing to accept my child because there's some kind of deficit, and they don't want it, which is wrong. But maybe from the school's perspective, it could be that they are not well equipped to manage those kind of children as well.
Okay. So I think the schools have to be educated.
Yeah.
I mean, because it's on the rise. I have a couple of acquaintances who have children suffering, or shall I say, children with autism. I won't say suffering from. And it's sad when you
Right.
see the kind of behavior. There are very particular repetitive forms of behavior that I've noticed. Am I right? I mean, there are certain things like the rocking of the body.
Yes.
Yeah, and sometimes flapping, those kinds of things that you see in them.
Yeah.
Is there any other kind of repetitive behavior that, a parent needs to take a look at or become aware of when the child is small, besides all the other things that you mentioned?
One more thing that I've noticed is that they tend to play with one toy more than the other toys.
Like a niche.
Toy.
Mm.
And one of the things that I've also noticed is that whatever field they choose to get knowledge of. So there was a kid who was extremely knowledgeable about dinosaurs. He would know
Okay.
history of dinosaurs and everything. And while taking therapy, he would talk about dinosaurs, and he'll tell me histories about dinosaurs and how dinosaur came and how dinosaur vanished. So when they are interested in something, they will go to the level of, that maybe I will not be able to understand the language. So they are very particular about what they are interested in, and they're very good at it.
Now that you tell me, there's this friend of ours whose brother is autistic. That's the term they don't normally use nowadays, who has autism. And he can read a thick book like that and then tell you which paragraph on which page and what it stated.
Yes.
Like a photographic memory.
Yes.
So they do that. And some are good at mathematics also.
Yes.
Oh, that's the point in time, I've noticed that certain parents feel that there is a chance of recovery and that they can become normal. There's that golden chain of hope that they want to cling on to. What happens at that point in time? How is it that you, as a child psychologist that interacts with the parent, because I'm sure they must be saying, will my child get all right? Will my child get all right? Have you ever encountered something like that?
Yes. They always have, it is actually very good to have hope with the child getting better, but that doesn't mean that the child will directly go into being normal again. So there are two types of parents I've encountered. One, parents not willing to accept that their child is diagnosed with autism, and they're not willing to accept the changes that the child has in their behavior. And there's also the other side of the parents who understand that the child is diagnosed with something, but they're hopeful that he'll come to normal again. So best way for them is to accept that the child has some kind of deficit, and it's okay to have some kind of deficit. All of us do.
Yes.
But always focus on the strength of the child. Because just because a child is diagnosed with autism or some kind of disability, that doesn't mean that it is just that diagnosis just them. They have a lot of strengths. That's if parents who are focused on those strengths have been able to, do really well for them, as well as the child has done really well in their lives. So it is very important for parents to be very patient and focus on the strength. And it gets very difficult for us to convince them that, this has happened.
Yeah.
And over the period of time, I have seen the child, the parent, as well as the child evolve into accepting their own diagnosis.
Okay.
And that has helped them feel at ease, because a lot of parents, when they get to know that their child is diagnosed with autism or neurodevelopmental disorders, they are in shock themselves. They don't want to believe that their child has some kind of disability. But when eventually over the time, when we have parent counseling with them, because it becomes tricky for them to accept their child, um, and then over the period of time they get better. But some parents also go the opposite direction, where they become totally ignorant about
Okay.
their children, and say that they don't want to accept it, so they're not going to put them for therapy.
And they leave them just like that?
Is there like that? Sometimes they have the societal pressure, because they don't want to put that, let the world know that their child is diagnosed with autism, and they force the child to behave in a certain way, but it is not
It
how
fires back.
fires back. I have also seen very extreme cases where they had a younger son who was diagnosed with autism, and his older sister was getting married. So they locked the autistic child with autism, sorry, and they went for the wedding.
And
So
how many days did they lock the child for?
it was around a week where they kept someone just to give him food.
Uh-huh.
And it was heartbreaking for me, because when I had a conversation with them about, why this kind of behavior they did, they felt like, my daughter wouldn't have been able to get married if they knew that uh, her brother
Oh,
was diagnosed with autism.
you mean the other family would have then refused?
Refused to. But we had this conversation where, it has no significance. Like, what does the family have to do with the brother?
Yes, I've known of a couple of individuals that I've worked with where they actually hid for the longest of time from other people that the child has autism. Yeah, but gave the best of treatment.
Yes.
That they definitely did. It's just that they were unable to tell the others that, this is it.
Yes.
So it is the shame, the dilemma, as you say, societal pressure
Societal
that
pressure.
stops. I think society really has to be educated on this, because those poor children, what they must be going through, the self-esteem would be at a complete ebb.
Yes.
Do they also then also feel these suicidal, what shall we say? Do they want to attempt suicide also? Do you have people with autism bordering on these kinds of?
I have not had any client of mine. Uh, it does affect them. They do sometimes, if they have that ability to kind of have the ideology of suicide, that doesn't really come so quickly to them.
Okay.
But
Alright.
for the children who, or even adults who are diagnosed with autism, they do understand what the whole world is saying about them. They may not be able to express the way other people are expressed, but there's the factor that they do understand that everything that is going around them.
And would that lead them to attempt suicide?
Mm, yes, there's a possibility of it,
Okay.
but I have not noticed any, someone who is diagnosed with autism going to that extent.
Yeah.
Yes, with depression and anxiety coming in, there's a possibility, but they wouldn't. I have not noticed, or I have not had any kind of seen cases like that where the child or the adult has attempted suicide.
Now that you speak of adults and they having autism, because naturally the child grows into an adult. We talked of inclusivity in schools. What about jobs? Are people like this who may be on this borderline or maybe the level 2, are they given jobs? Are they accepted at places because they have special what shall we say, like they can read well or they have their mathematics, those kinds of areas, great potential in certain aspects of life. Would they be accepted? Would they be given jobs?
That is one of the difficult things that a lot of societies are facing.
Okay.
Not just Indian society. They have they're trying to create kind of different jobs for them. So usually, if you know that a child has diagnosed with autism and has intellectual disability, we usually tell them to go into vocational education system, where they're
Okay.
taught pottery, they're taught how to be a waiter, they're taught different skills, and based on the skills that they are very good at, they get jobs. But those jobs also come with the side effect where the people are not going to be that accepting.
Uh-huh. So we have that spectrum also over there.
Yes. So it is more of a, there have been a lot of organizations who are trying to get people, they have this, special, so a lot of universities as well, in foreign countries have this where, we want to have a child, maybe one or two child who's diagnosed with autism, and we're making special provisions for them.
So I see a lot of this, the US and the UK taking a lot of measures towards autism. What about India?
India is
I mean, we already know there's not much of acceptance, but is the government, are there societies that are taking special measures to make people aware?
the governments are making policies for them. There's a disability policy around, but the main factor that really affects is what is happening at the ground level. So if school is made compulsory to have maybe someone who's diagnosed with autism in their staff, but are they really themselves accepting of those things?
Okay.
Because a lot of the schools, they say, okay, the government has made policies, the government is helping them, but how much policy is getting implemented is a question. And it also comes down to the bottom line where, is the school or is the organization accepting towards it?
Mm-hmm.
So if they feel like it is something that's going to hamper their business, that hamper their own image, so they don't tend to go there,
Okay.
that direction.
So, Aditya, yes, we have got to do a lot more in India. My next question to you is, I mean, is there any alternative therapy?
So in India, there have been a lot of alternative therapies that have come out, but one of the things that we always tell the parents is that whenever you go for any therapy, look at the scientific basis of it.
Okay.
Because there are a lot of people who open their own centers. They don't have those kind of education knowledge. And so we tell them to be educated about what therapy the child is going through.
All right.
So one of the under therapies that is becoming very prominent in India is a sensory integration therapy, where the focus is on integrating all the senses. So
Okay.
like I gave an example of one of the things that I tell parents whenever you go to a therapist, psychotherapy center for your child with autism, is that always look for the evidence base. So when they tell you what therapies they're going to be doing, have kind of some kind of knowledge of therapy that they are using, and always focus on if it's scientific based, because there are a lot of therapists and a lot of people who are started therapy centers, but
Okay.
their basis is not based on science.
Okay.
So the therapies that we use is application behavioral analysis, ABA therapy. Then there's play therapy, and when we do a combination of those, as well as in inputting some social skills that. So we blend them together depending on how the child responds to the therapy. If the child is old enough and understands, then we also go through cognitive behavior therapy or REBT with those children as well.
What is REPT?
Rational emotive behavioral therapy.
To do with emotions.
Emotions as well.
So these are some of the therapies that you employ. So could you tell us some more of the different kinds of therapies that you employ so parents are aware?
So application behavioral analysis therapy is basically when the child comes in for therapy, you pick up one aspect that they're missing out and you focus on that aspect.
Okay.
So basically, if they have like a motor deficit, for example, so they'll, you basically pick up a spoon and they're eating with the spoon. So you do this repetitively.
Okay.
So their focus is more towards practice makes a man perfect kind of
All right.
approach. So you put them in terms of social skills, you put them in a social situation, create the role play, and then you basically interact with them and how that role play will go.
Okay.
So that is one part of it. Then there's sensory integration is more of a device-based therapy, where they're given like music therapy, some music for them to integrate their senses. So sometimes some individual will seek more sensory needs, and some might get sensory overload. So balancing that out, that is what the therapy does. Then there's the CBT RBT is basically the child who understands talk therapy, moreover. So those are two, three. Play therapy is basically a lot of observation, and you're playing with the child, and through the play, you understand what the child is going through.
I see. And what about art-based therapy?
Yes, art-based therapy. We do art-based therapy. Art-based therapy is also there. Thank you for reminding me. So art-based therapy basically is that they draw in a certain patterns, and the patterns and how they draw, those kind of analysis kind of gives an insight of what they're thinking, and how we can move our therapy forward in terms of art-based therapy. So it usually works. The play and art-based therapy usually works with children who are not nonverbal, or those, because there are children who with autism who are nonverbal as well as verbal. So nonverbal children, first of all, they have social deficit, they don't want to talk, and the second part is they're nonverbal. So art-based therapy works fantastically with them as well.
All right. I've also read sometimes that these kids, they don't make friends very easily.
Yes.
Yeah. And what happens? Do they live very lonely lives? You said in inclusivity at schools, there are other kids who come and become their friends.
Yes.
But if they're not there, they would be very lonely, or they don't feel that. They don't have emotions.
They do.
Is that a misconception that they don't have empathy or compassion?
Yes, it's a misconception. How I look at autism overall is that their brain is wired differently. They process things differently. That does not mean that they don't have emotions or empathy. The way they express those things are different. What something that who's diagnosed with autism is, they don't like social interactions. They don't know how to interact with people. They tend to like being alone. They enjoy their own company a lot more. One of the simple examples in play therapy is that if you take 3 group therapy in play therapy, you have 3 children, different children sitting. It becomes quite evident that when the child is not willing to play with the other children and would prefer playing alone in a corner.
Okay.
So that means that he is not engaged in social aspects as well. So we do a lot of engagement therapy where I bring different children in therapy together, and then we tend to ask them to have a conversation with the different child, or play with the different child, and they do not like it. They sometimes will throw tantrum because that is their comfort. But because they don't understand social cues, they're not able to speak properly in terms of social aspect. They don't know what is rude, what is nice, how to be nice, because they have that deficit. They're not able to understand those things. The children who don't know about that disability will tend to just not play with them. So they tend to get lonely. But there's also an aspect that they are okay with their own world. They want to interact in some instance, but they don't know how to. So this is all the therapy aspect comes in, where we're helping them, guiding them how to get into social settings, how to do well there, what to say, what is not right, what is wrong, and kind of pushing them, because it is not something that they will first instant go and say hello and hi. Their thought process is, what's the need of it?
Yes.
And why do I have to be polite with people? Why do I have to talk with them? I'm okay the way I am. So there was a child who was 16 years old who's diagnosed with autism. One of the things that I had taught him is that whenever he comes, he has to say hi, hello to everyone, or say good morning, good afternoon, and then come to the therapy.
Okay.
So he would sometimes do it, but he would not do it a lot of times. And then when I asked him why you did not do it, he said, I don't understand the need of it. And that is coming also from his social anxiety, because he gets very scared of people, because he's not in the practice of talking to other people as well, but also the uh, autistic factor in it.
This must be so difficult and challenging for a parent.
Yes.
Oh gosh, I can go on and on. So what are the risks? I mean, genetics is one thing where, you can have a child with autism. I've also read that, and you've also mentioned that if there is a sibling who has autism, there's every possibility that the other child can also have autism.
Yes.
What other risks are there? Late pregnancy, would that also determine the mother from having a child with autism?
Yes. Pregnancy above age of 35
Okay.
is something that research has said that late pregnancy can lead to a neurodevelopmental disorder. It is not just autism, it could be anything. And one of the things I have noticed in my practice is that when I take case history of parents, I have noticed that a lot of the parents are above the age of 35. It could be mother or the father, but mostly mother who is age of 35.
So this is with the first child. Sorry to have interrupted. Is it just with the first child above the age of 35? I mean, the first child should be born before that. And then if the mother is 35 and has a second child, then it's okay.
No.
Uh-huh.
So I have had a client,
Okay.
they had a child when she was 26. And then she had a son when she was 38. So there's almost 12 years of age gap between the two children.
Okay.
And the second child was basically diagnosed with autism. But it is not necessary that just because you had a late pregnancy that the child might have, or there's a chances are high, but might have autism or other neurodevelopmental disorders. But it is one of the factors uh, that is mentioned. It's one of the factors that we talk about, because with autism, one of the difficult things is no one particular thing that you pinpoint to and say that, okay, this is because of this. There are a lot of factors. It could be lifestyle, it could be having processed food, it could be difficulty during pregnancy, it could be the health of the father, the health of the mother, how it was, what kind of environment they are living in, the stress levels of the parents, if they're the home they're living in or the office space they're working in, is the hostel space nice, is it toxic, how are the stress level, how are they processing things. So there are multiple factors. There's also a talk about nutrition of parents before they conceive the child. So there are so many factors that we can talk about that has contributing to a child being, giving birth to a child who's diagnosed with autism. So that is, the research is, unable to say, oh, this is the thing.
We can't determine any one thing because of which you can have a neurodevelopmental disorder.
Yes. And it is also during pregnancy, what food the mother had. There's also about substance abuse before or after. It could be a lot of different factors.
A lot of different factors.
So now research is focusing on, even recent research I read is that the future about how research in autism is going to go is they're talking about a gut health.
Oh, that is the primary thing nowadays, is gut health. Your gut is your next brain.
Yes. Advise parents before they're having child is that go to a genetic counselor. So there's a new thing where they look at your genes, they look at your health to understand how your child is going to be, if you're okay to conceive. And a lot of parents are also advised that during pregnancy, go for therapy sessions, psychotherapy sessions, or family therapy sessions, group therapy sessions with your family members. That has helped a lot of parents as well in recent times.
And they're accepting to doing that.
Yes. So for the families who are aware about how mental health works, how things work, they are coming to a lot of us for therapy. They will have conversations about it, and it has seen a significant difference on how the child is as well, especially on women who are going through pregnancy.
Oh, we had a delightful conversation, very intense and interesting. I think we can go on and on about autism.
Yes.
There's so much to learn, there's so much to do and implement. My last to you is there anything that you would like to tell parents, young parents especially? What is it that they should be looking for? Once again, I mean, you did give us some tips, but anything specific? What would be your advice to parents?
My advice to parents is before you conceive, have conversation with your pediatrician, doctors, and even go through a genetic counselor as well as go to a psychotherapist as well to have a conversation about it. It does help a lot. And next thing is, if you do have a child who's diagnosed with autism, is to not panic. Is to focus on the strength of the child, because there have been a lot of cases in the history where the parents have focused on the strength of the child, have been very patient with the child, because with autism, with any other neurodevelopmental disorder, you have to be very patient, because a lot of parents come to us for therapy after maybe 1 month or 2 months. They are like, oh, nothing is happening, nothing is happening. And we tell them it is an disorder that needs some time. And one of the interesting cases that I actually want to share here is that I was working with a child who had speech delay. He was not speaking at all. And the speech therapist and we were working together to help him speak. And also I was focusing on the behavioral aspect as well. At the age of 9, he was coming for therapy for 5 years. At the age of 9, he started speaking.
Oh my God.
So I was so appreciative. We've called the parents, we told them that, uh, we are thankful to you because you kept the patience of 5 years, putting in, you believed in us for 5 years, and now your family, finally your child has started speaking.
Was the deer in India?
Yes, it was.
Oh, nice.
So,
Very nice.
so it takes time. They put in a lot of resources. They did not have that many financial resources, but they put in everything, and their child started speaking. And he started speaking as if there's nothing wrong or he had never spoken. He started speaking very normally, and he was basically able to collect all the things that we did in the therapy. So he was able to remember what happened 5 years in therapy session, what happened 6 years in therapy session. He started talking.
Lovely.
So patience is very important.
And this was a neurological disorder?
He was diagnosed with autism and there was a delay. So there's a lot of chances that children who have delay start to speak. Parents who have a child with autism, diagnosed with autism, they have to learn new ways of parenting. Because if the child is not able to speak the way they speak, do not put your child under the rug, because a lot of times it's easier to ignore the child and always focus on the strength.
Aditya, thank you so much for this. And our lovely audience out there who's listening in to us, parents, young parents, parents who may have, children diagnosed with autism. I pray for you all, bless you all, and I do hope you have listened in and taken some tips from Aditya. And God bless you all.